Do you want to become a psychedelic psychotherapist? Here are some tips to get you started.
Hi there, my name is Dr. Sandy Newis, also known as Sandra Newis, and I am with the Living Medicine Training Institute. And I am here to tell you about 3 steps that you can take today to begin integrating ketamine-assisted psychotherapy into your clinical practice. But it would be almost impossible to be a provider and not having seen countless articles and media reports on the power of ketamine, as well as the increasing frequency of references to the psychedelic therapy revolution and other types of psychedelic medicines as well, particularly MDMA and psilocybin. And you may be wondering, as a provider, how do I get involved in this? This is something I'm really interested in. This seems really powerful, and it's something that I really want to get involved with. So again, I want to offer 3 ways that you can begin to immediately do this. I did it myself, and so I've actually lived this. Right? I began on training with the Living Medicine Institute in 2019, and at this point, I'm doing ketamine work full time. So 3 effective ways that you can do this. The first one is develop a relationship with a prescriber. See if you can network with prescribers. See if you can find out who in your community is already offering ketamine services. So ketamine treatment and ketamine assisted psychotherapy are 2 different things. So which prescribers are offering ketamine treatment? And can you then go to them and offer to provide ketamine-assisted psychotherapy, also known as CAP, for their clients. You can sell them on the fact that this might actually help them provide another service for their clients, or provide another revenue stream for them, expand their reach, and also be able to increase their volume. Simply put, with you there, they can see more clients at the same time and offer an expanded range of services because you are taking care of some of the clients. So present it to them as a win-win. Number 2, I invite you to reach out to some of the quote unquote mail order ketamine services. Most of them offer psychedelic integration services or offer some kind of support to clients during the journey or after or before. Some of them offer therapy over Zoom. Right, or other types of video platforms. This would be a great way to begin the process of learning to work with the medicine and also how to be part of a client's experience while also providing a valuable service. And it would give you a window into whether this type of work is for you. Is this something you enjoy doing? Do you enjoy being with clients who are in psychedelic states or altered states? Most of that work is done through video. So again, simply researching what those programs are, reaching out, see what kind of psychedelic integration or therapeutic support they offer, and see if you can actually begin to contract with them and provide that service. Number 3, attend a high-quality training program that really emphasizes the integration of clinical experience with the medicine. At the Living Medicine Institute, we think having direct experience with the ketamine itself is a really critical part of becoming an effective provider. And in our trainings, we offer more experiences with the medicine itself, as well as really solid evidence-based clinical practice and focus on that integration. At these trainings, and what I've witnessed in other domains, is that people are busily networking. And this is a way for you to connect with other interested providers or prescribers in your area who might be interested in either starting something or, again, expanding their offerings. But most of all, I want to emphasize again, as we've emphasized in our videos, really learn to be a great therapist first and develop your niche. Learn to be a good psychedelic therapist, right? Don't go and get a variety of different certifications and explore that. Just learn to work in the psychedelic space. And I want to also offer, learn to be a good therapist first, develop your clinical specialty. For example, I focus on trauma, chronic stress, and anxiety. So how do I work with that in the psychedelic space is really the kind of very specialty area. All right, specialize, be an excellent clinical professional, and bring that niche and integrate that into the psychedelic space. All right, learn about the process of working with ketamine, network with prescribers, really get training and skill in order to do this, and you too can begin this journey.